Hi, my name is Ellis Michaels, and I was diagnosed with Behcet's disease in 1997. In this video, I'm going to tell you about some of the different kinds of mostly non-medical professionals that Behcet's patients sometimes see. And I'm going to start with mental health. There's a few mental health professionals that, and some of them are medical professionals as well, but I saved them for this video instead of the last one, which, if you missed it, I talk about the different specialists that Behcet's patients typically see, medical specialists. But in this video, I'm going to talk about some mental health specialists and some other people that, some other professionals that you might end up seeing because of this lovely, wonderful, so much fun disease. So let's jump right into it. So, psychiatrists. You might end up seeing a psychiatrist. I've seen one or two myself, or, like 5. But psychiatrists treat mental illnesses, or at least on paper, that's what they do. In reality, they treat symptoms. They treat everything from depression to anxiety, to more severe things like schizophrenia and all kinds of things. I don't want to go too deep into my own personal feelings about mental health. I went to school for clinical psychology. I worked in the mental health field for 15 years, and I have a lot of criticisms of it, but I'll save that for another time. Anyway, people with Behcet's are often suffer from depression. I battled it for many, many years. Same with anxiety. Just crippling anxiety for years. So you might end up going to see a psychiatrist to get some help for that. Psychiatrists, they used to do therapy and prescribe meds a while ago, but now they mostly just throw pills at you because the insurance companies want them to just get patients in and out as quick as they can so they can make more money. So psychiatrists now pretty much just do medication management. They don't really do therapy. For therapy, you're going to want to go see before I get to therapists, let me mention APRNs. These are advanced practice nurses. Some APNs or APRNs. These are nurses that not only have their RN bachelor's degree, but have gone on to do graduate work and are licensed to prescribe medication under the guidance of a licensed physician. And I've actually seen a couple of APRN psychiatric nurses, and they've been great. I'm currently seeing one, actually, and have been for several years, and I'm very happy with her. They tend to take more of a holistic approach than psychiatrists. They tend to spend more time talking to you, and they tend to be less cocky and arrogant and all that other shit that comes along with being a physician. Not every doctor is like that, but many are, especially psychiatrists. So you might have better luck with an APRN, but both of those, psychiatrists and psychiatric nurses, both prescribe medication. For therapy, you've got a few options. Now, there are therapists, psychotherapists, which are master's level clinicians, usually, who they go to school, like me, go to school for psychology and then go to graduate school into like a master's program for clinical psychology, and they have to do an internship and fulfill all these hours and stuff like that, and they get licensed as a therapist. And this is talk therapy. They don't prescribe any medications. You just go in and you talk about your problems, whatever's bothering you and stuff. The truth about therapists, I worked with hundreds of them. Most of them suck. A lot that they mean well, but most of them are pretty ineffective. However, there are good ones out there. So I encourage, and therapy can definitely be useful if you have a good therapist and you're willing to work on yourself. So don't let that deter you. And if you go to a therapist and he or she just sucks, go to another one. You might have to go to a few before you find one that you really, really click with, but it'll be worth it. So keep looking. Higher up on the ladder, you've got clinical psychologists. Now, these are doctors. They're not medical doctors, but they either have a PhD or a PsyD, a doctorate of psychology. And these doctors also do talk therapy. They also do psychological testing, IQ tests, personality tests, all kinds of different psych tests, and they do some other stuff too. But these clinical psychologists are, again, like therapists. There's kind of a lot of shitty ones out there. There tends to be less shitty clinical psychologists than therapists, in my opinion, but there's still some not so great ones out there. But there are some awesome ones too. So if you end up seeing a clinical psychologist, you might end up if you end up seeing a clinical psychologist, there's a good chance you'll find him or her helpful. And you might also, if you've got issues with substance abuse, I got hooked on opioids from the medical profession. They were just throwing them at me like candy all throughout my teens and 20s. And what do you know? I found myself addicted to them after a few years of that. And I saw a substance abuse counselor for a while, and she was great. She was wonderful. She was actually also a clinical psychologist. She was a licensed substance abuse counselor and had earned her PsyD. These are professionals. There's different levels of substance abuse counselors, but they all, I believe they all require at least a master's degree. So these are all professionals. And a lot of substance abuse counselors, I would say the vast majority of them have personal experience with substance abuse. A lot of them are clean or sober or whatever they want to call it. They struggled with drugs. They overcame it, much like myself. And in my opinion, the ones that have overcome it and struggled with it themselves are the best ones because they've been there. They understand. Yeah. Family therapists. There's one more I'll mention in the mental health side is living with somebody with Behcet's or having a loved one with any chronic illness can be really, really hard. Whether it's your wife, your husband, your daughter, your son, your mother, your father, whatever it is, it can be hard. It can, especially if it's your significant other. I mean, chronic illnesses make dating hard for a lot of people. It's hard to be with somebody when they, one day they feel fine and the next day they can't get out of bed. It's tough. So family therapists, marriage therapists are out there. You might end up finding some of them helpful. I've never been to any of those. I don't know, nor have I worked with any really. Maybe one or two clinicians I used to work with were certified family therapists, but I don't have much experience with them. But those are the mental health specialists that you might end up seeing. And I'm going to just mention a few more professionals that you might find helpful to ease the symptoms of your Behcet's. One is a physical therapist. If you've got, Behcet's can cause all kinds of problems with your joints and stuff like that. Physical therapy might be able to help you increase your mobility and your flexibility and all that other stuff. So that's something to consider. Doctor might recommend it. Dentist, oral hygienist. Behcet's has caused so many problems with my teeth. And the drugs I'm on, prednisone, or have been on, I should say, caused a lot of problems with my teeth, and I've spent so much money getting them fixed in there, and I'm about to drop a lot of money to get them just completely restored. But dentist, hygienist, stay on top of it, because with Behcet's, between the inflammation in the gums and the side effects of some of the medications that we take for it, it can wreak havoc on your mouth. Some people are lucky; their teeth, they'll never have a cavity in their entire life, and other people, their teeth start falling out of their head when they're in their teens. So genetics plays a big factor, but keep on top of that. Dietitians. You might want to see a dietitian to come up with a special diet for you to help, to see if that helps. Some people swear by it. I've talked to people who, not just Behcet's, but other autoimmune and autoinflammatory illnesses that like I know somebody who had some, I forget what his actual diagnosis was, but he had something and he switched to an all meat diet. He just completely cut carbohydrates out of his diet, ate nothing but meat, which is all fat and protein, completely cured his symptoms, enjoy everything, fine. But other people, it makes no difference. So everybody's different when it comes to diet. That's why there's no one size fits all diet that's going to be great for everybody. So you might want to see a dietitian. This is an RD, a registered dietitian. Now, be aware that nutritionists don't have any... I could call myself a nutritionist. Hi, I'm Ellis. I'm a nutritionist now. But registered dietitians actually have to go to school, have to get, I don't know if it's licensed or certified, but you can't just go around calling yourself a dietitian. But you can as a nutritionist, so be aware of that. Personal trainer. If you want to work out, get in better shape, find somebody to help you out in the gym. I wish I had a personal trainer in the first few years I started going to the gym because I didn't know what the fuck I was doing, but I figured it out gradually. But you probably don't want to go through all the hassle. So if you want to get in better shape, lose some fat, build some muscle, whatever you're trying to do, see a personal trainer. They'll help you out. There's a lot of great ones out there, and they're like anything. There's some that suck, but there's a lot of really good ones out there too. You might want to. I've got two more things I'm going to mention. One is a patient advocate, and I don't have one of these myself. But especially if you're like severely disabled, you might want to get yourself a patient advocate, and that's somebody. I'll make another video another time about what they are and what they do exactly in detail. But patient advocates basically help you set up your appointments, medication, make sure you take your meds on time, things like that. It's just somebody to help out. They can be very helpful for a lot of people, especially when you're severely disabled. And lastly, I'll mention, and this is totally not for me, but members of the clergy. If you are particularly religious, if you find strength in, whatever it is, whatever religion you happen to, to be a part of, if that brings you strength and hope, go talk to your priest, go talk to your rabbi, go talk to whoever, whatever. Talk to a shaman, whoever you need to talk to, whoever will help lift your spirits and make you feel better. It doesn't really matter. Like I said, personally, that's not going to help me out at all. But if you're a believer, and if I don't judge that at all, who the hell knows? None of us really know, right? So if you're into that, excuse me, I shouldn't put it that way. If you're a religious person or a spiritual person, yeah, you might want to talk to a member of the clergy just for a little extra, whatever, just to feel a little better. And those are some non-medical, although I threw a few medical ones in there, but those are some non-medical professionals and people that you might find helpful with easing these symptoms and just the day-to-day suckiness of Behcet's. It's going to suck no matter what, but a lot of these people can help you. If you find some good people, it'll make a big difference for you. So thank you for watching. If you want to hear my whole story, you can check out my memoir. It's called Finding Happiness Through Pain and Embarrassment, My Life with Behcet's Disease, a memoir. And it's by me, Ellis Michaels. Thank you for watching. Be well.